we have this scenario. So let me ask you, remember we're at the bottom of that pyramid where there has been apparently a single lapse. And for whatever reason, the individual who observed it may have taken Dr. Pichert aside informally, maybe didn't, but at any rate, made a report. That increases the stakes. And you nurses, don't you dare think that you're off the hook. I started with a whole series deliberately of discussions about accountability with my physician colleagues because that's where we decided that we had to start at Vanderbilt. It may be different here. This is not a physician bashing session. In fact, in just a few moments, we're going to learn why there is this phrase, nurses eat their young. Have you heard that? There are a lot of people nodding. So this is an equal opportunity bashing session. But it's not about bashing. It's not. It's not about gotcha. It's about being professional. And frankly, I don't care whether you are the CEO or a housekeeper. It takes everybody to make our great organizations great and greater. Everybody. And so think of this as an interdisciplinary kind of exercise in thinking about how we can promote professionalism. And part of that means promoting accountability. Now, I started deliberately, as I said, with physicians because the nurses, the pharmacists, the techs came to us and said, if you're going to institute quality, safety, risk reduction sort of efforts, please don't repeat the mistakes of the past. Great, what are the mistakes of the past? Well, every initiative begins with nurses and pharmacists, and we do our very best to implement them, or so they say. And then Dr. Pichert says, no, that's stupid, and so we all quit. And so we decided that for us, in a Southern culture, hierarchical as all get out at Vanderbilt, we had to start with our physician colleagues. Now, we have the opportunity to get nurses and pharmacists and techs to come to us and say, we need this too. We see that it's working. And so in just a moment, like I said, we'll have an opportunity to use nursing examples as well as others. But please, these behaviors are virtually universal because they're human behaviors, right? So please don't be totally offended, just offended enough by my use of physician examples to want to apply it to your colleagues in other areas as well. So thank you very much for the good cups of coffee that got served up. The other thing is that, dang it, this was a report about hand hygiene. I mean, why did this have to be reported in the first place? It gets documented. That raises the stakes. Somebody's going to now come to me and have a conversation. So my question for you is, can you have a conversation with a colleague and make it collegial? Does it have to be punitive? Sometimes we teach one another and model punitive behavior. And so the question becomes, how might an informal conversation look like? What would it feel like? What would it sound like? So this is a non-rhetorical question. If you had not washed your hands and a colleague just took you aside, said, can I have a moment with you? How would you want that conversation to go if you were on the receiving end of it? What would be one characteristic? You would want it to be held in private, not announced to the entire dang unit, right? What else? Excuse me? Constructive, just bringing to my attention. You don't have to teach me how to wash my hands, right? You just give me a heads up. What else? Non-judgmental, thank you. Not holier than thou. Just colleague to colleague. I saw.
Give the benefit of the doubt.
Give me the benefit of the freaking doubt. I mean, I know this, but I'm busy. I got 120 things on my mind. Just give me the benefit of the doubt. Thank you. What else? Stick to the message. I mean, don't use it as an opportunity to bring up all my other failings. I mean, you'd need one of those tanker trucks of coffee if you did that. So just stick to the one message. Thank you. What else? Collegial, non-punitive, private, single message, just a heads up. Brief. Oh, thank you. Yeah, if these go beyond 3 minutes, that's just sort of ridiculous. And so the question is, if these are going to work, you got to know how to start, and then as I mentioned before, you got to know how to get the heck out of Dodge. But these conversations persist because you just want me to fall on my knees and say, oh, thank you. Oh, I'm so grateful that you brought this lapse to my attention. I mean, I may react sort of badly. And so you may want to persist. No, that's not the purpose. Just do the right thing and move on. We'll talk about documentation later. But I'm not going to document this kind of conversation. No. That raises the stakes. That makes it more punitive. I'm going to write me up? No. I'm a colleague. But we'll talk about that. So if you were on the receiving end, you'd want it to be non-judgmental. In this case, you'd want to at least be sure that I was willing to be uncertain that this was a third-party report and there was another side to the story. There often is. This is not a crucial conversation because those require investigation. You have to be certain of the data. This is an informal collegial conversation. Got a report I didn't understand. Thought I'd share it with you because I know you to be a great professional. Report didn't seem to be consistent. Non-directive. Give me a chance to come to my own conclusions, solutions. Don't expect an apology, a thank you, or anything other than a couple of minutes of time. For a single event, I mentioned that we have this sort of regular cup of coffee, and in a moment, if you need to kick it up a notch, as Emerald says, we'll go to espresso. Can anyone have these conversations with anyone? Theoretically, yes. So does a ward clerk have this conversation with a cardiothoracic surgeon? Maybe 2% of the time. And if that happens, and we have those ward clerks at Vanderbilt, I'm proud to say, then next year I hope it happens 4 or 6% of the time. It's about culture change and supporting one another. Informally, you approach using the same principles that you all know for sharing bad news that might be taken as bad news, so that the goal really is to maintain trust, respect, minimize distractions, avoid the tendency to downplay its seriousness, balance empathy for all the things that are going on that are distractions with some objectivity that, oh, now I understand a little bit better, but we have these goals and principles, and I know you're committed to them. And there may be a range of responses from in-your-face rage to a blank stare. And it's okay. Your role, if you come to me, is just to report to me that you saw something that just didn't seem consistent with who you know me to be. That it's noticed, and that there are lots of eyes and ears, and gosh, just don't want the patients and families leaving here and other staff members to think poorly. It's not a control contest. And that's where many of us in leadership positions can get sidetracked and derailed. It becomes punitive because that's the modeling we've seen from other leaders. Now, this is collegial. I'm coming to you as a colleague. Don't expect the thanks. Like somebody said, Stay on your message. And because you will sometimes be having these conversations with folks that you know and who know you, they may know your buttons and will push them. And that's okay, just be prepared. Because if you open and close the message, my colleagues at Vanderbilt, regardless of their disciplinary field, say that the hardest thing is starting, and even harder is finishing these conversations. So, you know, Jim, you're important. If you weren't, I wouldn't take this minute with you. I heard or I saw, and I hope you will have these conversations when you hear or you see, not when you just get a report. Review the incident, give me an opportunity to respond, and then close. You're important. I feel like now that you've said a few words that I understand a little bit more better, as we say in Tennessee, but you know, we've all got to respond professionally. And what I saw just doesn't seem to be consistent with our honor code or the protocol or the pathway that we agreed on. And here's going to be the hardest part for you seasoned professionals. Some of your colleagues are going to look at you and say, well, okay, so what do you want me to do? And because we are all in this room fixers, we're so eager to tell our colleagues exactly what they need to do, right? Some of you are anyway. And so as a consequence, I'm going to ask you to wrestle with this fixer nature. Like was said, just call it to my attention. Have enough faith in me as a professional that I can fix this myself if I reflect on it. Now, what's the problem, or what are some of the problems with giving me advice in a collegial conversation? What's one?